Studies show that about 50% of women will experience urinary incontinence at some point in their lives. Usually their family doctor or a friend will tell them about Kegels. It's a well-known exercise for urinary incontinence. With the best intentions, they're often not done properly. And after childbirth, a lot of women can't do Kegels because of damage to the nerve. But most women are not, very good at following a routine. They're busy raising their kids. So it's a great first line, but it's not always as effective as we'd like them to be. EMSELLA is a great new technology that uses high-FEM technology, which is basically high-intensity focused electromagnetic energy. It can bypass the skin and the subcutaneous tissue and affect powerful contractions of the pelvic floor. The patient stays fully dressed. It's a very simple procedure for them. Women can sit on a chair reading a magazine and have 11,200 supramaximal contractions, basically Kegel contractions, in a 28-minute session. The pelvic floor muscles are extremely important to remain continent. Lasers do nothing to the pelvic floor. So often I'll use these treatments in combination, or actually I'll suggest that they do EMSELLA first, because I think that's the bigger part of the puzzle. It's a really great thing to offer in a medical aesthetics clinic because your clientele for your aesthetic treatments are basically the ones that would benefit from EMSELLA. Those women are aging, all parts of their body are aging, and a lot of them do have problems with incontinence. This has been a great addition to my clinic because after training my staff about the benefits of EMSELLA, they can basically take it and run with it. I don't have to handhold them. I don't have to see the patient even. I mean, I often do just to say hi, but really the staff take over. They're excited about it, and that transmits to our patients. I definitely have patients that have gone from having some stress incontinence to no incontinence. Some women have post-void dribbling, and that's been taken care of. We have women that have not noticed that they improved as much until about 6 months later when they're running back and saying, I think I need to have a treatment because I'm worried that it's going to come back. It's been so nice to not have this problem. So can I sit on the chair maybe another couple of times? And of course we can offer them that. I think this is a great treatment, something that you should bring to your clinic because you're treating a condition which a lot of women don't want to talk about, but it is a medical condition and it has a severe impact on their quality of life in some cases. So you can actually make these women's lives better.